All right, so back to toxicology. Again, we need to understand what was taken, when it was taken, how much was taken, what it was taken with, and then they take anything else to try to alleviate some of the symptoms or alleviate some of the response of the toxin that they took in. Again, we're going to be looking at medications that deal with over-the-counter use right now, and these include Tylenol, aspirin, and NSAIDs. We need to understand that sometimes these medications are mixed in with narcotic medications that are prescribed, so they're not just over-the-counter. So keep in mind when you're looking at that, the patient may have taken some type of over-the-counter medication in conjunction with their own medication that was prescribed, and so again, just keep in mind. Now, Tylenol is acetaminophen. It falls under Tylenol, APAP, paracetaminofen, in other countries other than the United States. And if we're looking at mixed medication, this could be like a Darvocet. Now, Tylenol is in a large quantity, and the quantity that we're looking at is about 140 milligrams per kilogram, 150, 160 milligrams per kilogram. We start going up from a toxic dose to a lethal dose. And so when we start counting out the medication or the pills, as far as what's missing in the pill bottle, we kind of guess whether or not how much was taken. And if the pill bottle said 50 and we have one left, we're going to err on the side of caution and say that about 49 were taken. Let the rest of the evaluation done in the hospital setting be conducted before we decide that this person is medically cleared and is not going to suffer some kind of toxic or lethal dose. So that being said, look at all medications and then calculate all the toxic levels of Tylenol or acetaminophen. Now, there are 4 stages in acetamin toxicity. The first stage is within the first 24 hours. The second stage is between 24 and 48 hours. The next stage is between 72 and 96 hours, and after that, stage 4 is going to be between 4 days and 14 days. And so we'll go over a little bit about some of the signs and symptoms that the patients will have. Again, this is part of the toxidrome that is specific to Tylenol and Tylenol only. In stage 1, within the first 24 hours. Now we get some upset in the GI tract. We also get maybe a little diaphoresis, and there's a lot of, well, it's not necessarily a symptom or a syndrome. There is some type, maybe some remorse or regret, or maybe even denial. So just look at some of that diaphoresis, GI upset, and then just remember that there is still the possibility of it being toxic. They may have vomited out some of the pill fragments, but we're going to wait for a Tylenol or a cinnamon level. Now, within that next period, the stage 2 is after the first 24 hours. Now, once we break into the 24 going on to 48, we look at some abdominal tenderness. As we know, the Tylenol right now is very toxic to the liver. So we're going to look for abdominal tenderness, abdominal pain, continued with some of the prior symptoms, nausea, vomiting, and diaphoresis. And at this time, it may be starting to elevate the liver enzymes. AST and LST. And don't need to really know about those liver enzymes. I just wanted you to know that it's now starting to affect the liver within the 24 to 48 hour level, and that's stage 2. Now we're moving on to stage 3, and it's 72 hours to 96 hours. At this point, we're starting to see some liver issues where it's not the liver and bile, there's the ability for it to be conjugated. So now all of a sudden we're not being able to excrete this, and so now the person starts to turn a little yellow. And what is that condition when the skin turns yellow, or the eyes as well become yellow? Skin yellow. Icterus? No. It's called jaundice. So the skin turns yellow, it becomes jaundice, and the eyes become icteric. Okay, so now moving on, as well as the liver toxicity that's going on, they can now start to have some arrhythmias, hypoglycemia, as they're affecting the glycogen storage. And again, so we're going to add on a lot of those other things: abdominal pain, nausea, vomiting, some diaphoresis, and now we're getting to have more vomiting and even some stupor or lethargy, because the liver is not unable to break that stuff down. It's becoming toxic. Stage 4 is further on down. So we've gone past the 72 hours, which is about 3 days. And so we're entering into the 4 to 14 days. So it's like a beginning of that first week, middle of that first week till 2 weeks on out. So now, hopefully, we've gone ahead and treated that. But if not, then we have some permanent liver dysfunction. Maybe the person actually will not survive this because the liver is just not functioning. What we would try to do in the pre-hospital setting is start our emergency treatments of supportives, life threats, so airway, renal circulation, obtain some IV access, monitor glucose, EKG findings, and such, because it may be a polysubstance overdose. But then we want to also get them to the hospital. One of the antidotes for Tylenol overdose or acetaminophen overdose is a mucomyst or acetylcysteine. So we'll talk about it a little later, but as this is not the primary drug of choice or treatment for us, this usually happens in the hospital, and again, they're monitoring enzymes on the way out. So stages 1, 2, 3, and then 4. 1 between the first 24 hours, 2 between the next 24 to 48 hours, and then after that to 72 to 96, and then we're going on to 4 days to 2 weeks. All right, so salicylates. Let's move on. So salicylate is aspirin, acetylsalicylic acid, ASA. It's a salicylate. Now, when we take this, it can cause tinnitus in the ears, coma, stupor, hyperthermia. This causes that increased temperature, right? Hyperpyrexia, become hyperpyrexic. Again, so we're looking at some lethal doses. As far as pediatric, I think I remember telling you guys some things like the liniments or the ointments in certain prescriptions over the counter as well. They have aspirin or acetylsalicylic acid in there, and they can be very toxic. A pea shape can have over a gram. And so when we're looking at the 110, 140s to 150s, 160 milligrams per kilogram, is lethal. Again, so there is no specific antidote for this. We might try to alkaline the urine. We might try activated charcoal if the medication hasn't been fully digested. But IV fluids, and then transplant them to the hospital. Remember, aspirin is a prostaglandin synthesis inhibitor, but it also deactivates platelets, and so we may have some issues with some bleeding times, but that's not necessarily the major issue. NSAIDs. NSAIDs are ibuprofen, Motrin, Toradol, those kind of things. So we can have prescribed or over-the-counter medications that fall into the NSAID category. Again, these might be polymixed or mixed with narcotics. So we need to take a look and see what's mixed with the patient's drugs. This can cause some headache, again, tinnitus, nausea, vomiting, GI upset. They end up going to some renal and pulmonary failure, as this one, unlike the liver in acetaminophen or Tylenol overdose, NSAIDs affect the liver, the renal system or the kidneys, because we have renal failure that coincides with NSAIDs. And so our ABCs would be followed, and then look at maybe activated charcoal, which we rarely do unless it's within the first hour. Again, same thing is be done with aspirin within the first hour, and Tylenol. We're trying to give these to bind, so they absorb and bind the toxin, so that it can be excreted out through the GI tract. And usually, this is mixed with some kind of cathartic. Cathartic allows that charcoal substance to then be easily passed through the GI tract. In NSAIDs, there's no real antidote for that. So the next few toxidromes and drugs we'll go over. Stay tuned.